Alright, hi guys, a very good evening to all of you. Welcome to ACE Pharmacology, ACE FMGE December 2020 series. And today's clinical vignette series will be discussing some important MCQs of the antimicrobials. So this ACE FMGE December YouTube session will be running today, tomorrow also, right, 7 p.m. right, and on Sunday also 7 p.m. right. So we'll be continuing few important discussion, and we'll be running that today, tomorrow and day after as well. So continuously 3 episodes will be running, and then the next part will be next week, right. Apart from that, I'm sure all of you guys are already aware that every Tuesday, Saturday and Sunday at 10 a.m. in the morning I'm also coming live for discussing all the important aspects of the pharmacology as well. And before I start this session, just let me know if I'm clearly audible and visible to all of you. All the students, those who are live right now and listening to me, please let me know if I'm clearly audible and visible so that we can start it already. I'll just wait for your comment, wait for your message in the comment section, please. All the students, please, any one of you, please reply. I'm just using another system here to reply to your messages and to receive your all right. I hope things are okay now. Hi everyone, please reply. Yes, audible. Okay, thank you very much. So before I start, as all of you are already aware that I have been teaching pharmacology and one of the educator of the pharmacology, right, with the teaching experience of the 5 year. I also happen to be author of the FMGE solutions, one of the topmost read book among the FMGE students, right. Have been mentoring from last 5 years, and so far more than 40,000 students I have already interacted with the more than 40,000 students, and already taught them, right, mentored them, right, from in last 5 years. So 5 years with actually 10 batches already, and not only that, NEET PG batches as well. Okay. Apart from that, a few important information about iconic subscription that we are having, right. So iconic subscription is like a mixture of the Unacademy and Prep Ladder both. If you are planning to buy, if you are in the second year or third year, definitely that's a very good deal for you, right. We'll talk more about this. Let's get started without today's session. The very first question that we are having is here. A 35-year-old male was diagnosed with the drug-resistant tuberculosis. Please read the question very carefully. He was advised to be started to ATT drug resistant category. ATT of the drug resistant category. ATT is anti-tubercular therapy. According to recent anti-tubercular therapy protocol, which of the following is a false statement? Please provide your answer in the comment section. I'll be checking your answers in the comment section, and accordingly we'll be doing a quick discussion, right. So in this I think a half an hour session we'll be doing around 10 questions, but all those will be highly important question and will be high yielding topics, right. Please go ahead guys, provide your answer, all of you. 35-year-old male, right, he was started on the drug resistant tuberculosis category, right. So I'm sure all of you guys are already aware that which one is a drug resistant category, right. Currently what all categories are running, and out of those category which one is a drug resistant? Please provide your answer guys. I hope things are fine. And okay, some of the answers I have started to receive, that students are replying A, right. Some of you are replying D. Every one of you please try replying, because this is the exact pattern of question that you are going to get with a longer case based scenario, with the longer options that you are going to get, right. So in the tuberculosis treatment, remember guys, multiple categories are available in the tuberculosis treatment. Whenever there is a tuberculosis treatment, in the treatment of the tuberculosis, you are having category 1. This category 1 is given to all the patients, regardless of the new, old, all the patients should receive, right? All patients will be receiving this, right? All the new, right, old, right, previously treated, defaulter, all the patient will be receiving category 1, that is the same as the drug sensitive tuberculosis, right? Same as your drug sensitive tuberculosis, that is your HRZE, right? HRZE into 2 month, right? And HRE, right? Isoniazid rifampicin, right? Ethambutol into, right, 4 month. Then you are having your category 4, that is given for the, right, MDR tuberculosis, and category 5 that we are having, it is your XDR tuberculosis, okay, MDR and XDR tuberculosis. So remember that, very important. Usually earlier we were following category 1 and category 2. Category 1 is for all the new cases and category 2 for all the older patients, right? Older and re-diagnosed, defaulter, right? Previously treated, category 2. But according to the new protocol, category 2 has been stopped. So there is no more category 2. Remember, there is no more category 2. And there was one drug among the aminoglycoside by the name of streptomycin that was used only in category 2. Once category 2 has been stopped, remember, streptomycin is no longer an ATT drug group, right? Under ATT drug group, we do not use streptomycin, we do not have this anymore. Earlier it was as a first line injectable it was, right? But now it is no more. So this is actually a true statement. You will have to find a false statement, okay? Rifampicin resistant tuberculosis should be given isoniazid in the intensive phase. Remember, this MDR tuberculosis that we are having, it can be a single drug resistant as well. It can be MDR TB means isoniazid plus rifampicin resistant, right? Apart from that, remember, you also call it as a rifampicin resistant RR tuberculosis, right? RR tuberculosis. In the RR tuberculosis, it will be treated same as your MDR tuberculosis. RR tuberculosis treated same as your category 4. The only difference, please pay attention, the only difference that we are having is isoniazid is added, right? In RR-TB, isoniazid added in the intensive phase, right? Intensive phase. I am sure all of you guys remember the mnemonic that I have told you for category 4, right? KP lease, right? If ever you want to revise whole tuberculosis with all the recent advancement, the tuberculosis, I have taken a separate lecture on the tuberculosis. It's freely available in the Unacademy, right? Freely available in the special class section. You can simply search it under my profile, tuberculosis, with all the recent advances. 3 important topics that I always I always recommend the student. That question will definitely be there: TB, malaria, HIV, and all these 3 recently I have taught. Okay. Category 5, I have also told you the mnemonic that we are having is CLAP for MCI. Okay, CLAP for MCI is the category 5. I hope all of you guys remember that. Okay, so MDR TB is given as a daily regimen. Yes, be it MDR TB, be it XDR TB, everything is given as a daily regimen, right? Now bedaquiline is given as a daily dosing for the entire duration of the treatment. Remember, first of all, both the statements are wrong. Bedaquiline is one such drug that is given in the MDR tuberculosis. Okay, agreed, right? Remember, bedaquiline is the recently approved drug. One thing that you should know, in the recent AIMS examination, they asked which side effect or which of the following investigation you should take care with the bedaquiline, right? They are associated with the side effect, that is QT prolongation. Therefore, ECG monitoring was recommended, right? ECG monitoring was recommended. Next question that can be asked to you: B for bedaquiline act by inhibiting your ATP synthase of the mycobacterium. Another very important MCQ, right? ATP synthase of the mycobacterium. Bedaquiline is one such drug, guys, who is having very high volume of distribution. Very important general pharmacology question. If any drug is having high volume distribution, therefore the drug will be having longer T half-life, definitely, right? So usually it is given only in the intensive phase. It is given only in the intensive phase. Remember, it is not given throughout the therapy. Only in the intensive phase it is given, and intensive phase is lasting for around 24 weeks, right? 24 week के लिए देंगे. In the 24 week also, remember, right? Initially it is given, right? Initially it is given daily, right? Initially it is given daily for 2 weeks, right? And उसके बाद से, right? Thrice weekly, right? Thrice weekly into 22 weeks, right? I hope it is clear to all of you. Daily for 2 weeks, right? Daily 2 weeks it is given 400 milligram daily, right? And after that for the next 22 week it will be given, right, 200 milligram thrice weekly. I hope it is clear to all of you, right? So bedaquiline very important drug and usually questions are asked. So drug resistant tuberculosis पे question expect करिएगा. Because of that particular reason only, right, I have given another question on the same topic. Please please just give me a minute. Bedaquiline is given as a daily for entire duration. Remember, it is not given in the entire duration, given only for the intensive phase. Remember, this is a false statement, right? Only few students have marked D, right? Dr. Kalpita and other students have marked D. Rest of the students they have marked either A, B, right? A, B, C, right? And I recommend all of you students, all of you those who are listening to me, please try marking the answers as soon as you see the question and try giving your feedback, right? Try giving your feedback. वो गलत होता है, सही होता है, it hardly matters, right? We are not here to judge you, right? So the false statement that we are having here is bedaquiline not given as a daily regimen, weekly, right? Thrice for the 22 weeks and then daily for the first 2 weeks, right? So only in the intensive phase. Next question is very important. Please read the question. Another 50-year-old patient with the MDR tuberculosis started on the B-Pol regimen, right? So if you want to solve this question, you should also know what actually is a B-Pol regimen, a short-term drug regimen for the XDR tuberculosis. Agreed? Okay. Okay. Next that we are having the mechanism of action of the recently approved agent pretomanid. So B-Pol regimen mein, what is B-Pol regimen that we are having? If you know this, give me a minute please. B-Pol regimen mein PA is small, right? There was a recent trial done in 2018 by the name of NEET trial, right? NEET trial, I'm sure all of you guys have heard the name, right? NEET trial was done, right? B-Pol regimen, where B-Pol was used, that is your bedaquiline, one of the recently approved, right? Bedaquiline, right? P stand for your pretomanid, okay? Another recently approved drug, pretomanid, right? And L stand for your linezolid. Please provide your answer, guys, for this question. The answer for this question, please. Which of the following is the right mechanism of action of this drug pretomanid? Simple question is that what is the mechanism of action of pretomanid, right? So pretomanid is the younger brother, or you can say younger brother of already known drug, that is delamanid. Okay, delamanid and pretomanid. Remember, delamanid and pretomanid. So remember, their name is coming multiple M. Delamanid, pretomanid, multiple M is coming. So they are going to act by, some of you are marking B, some of you are marking A. Okay. Okay, so remember they are going to act by your mycolic acid synthesis, right? Remember, delamanid, M for mycolic acid synthesis, right? Mycolic acid synthesis. What did I told you about bedaquiline, guys? I told you already about bedaquiline. I hope you guys listened to me earlier. I told you bedaquiline starting with letter B, right, and acting by inhibiting A, right? So ATP synthesis. अब इसको एग्जाम में कोई भूलिएगा नहीं. Please do not forget this in the examination at any cost. B bedaquiline, A for ATP synthesis, delamanid, pretomanid, multiple manid, M word is coming, that is your mycolic acid synthesis inhibitor. Okay, so I hope it is going to, you are going to remember this. Then B-Pol regimen is a short-term regimen that was approved via the NEET trial, right? It's a short-term, right, regimen that is given for a duration of 6 months. Even the simplest of the question can examiner ask you, B-Pol regimen is given for how many months? Option will be 6 months, 12 months, 18 months, 24 months. Simple question can be asked to you. The duration of the B-Pol regimen, that is given for 6 months. However, it can be expanded up to 9 months as well, right? So the trial has shown very good result, right? Very good result. More than 80% of people where sputum smear negative after this B-Pol regimen. That was given for a 6 month to 9 month. To which patient, guys? It was given to, right, XDR, right, XDR TB patient. Okay. It is given for your extensive drug resistant tuberculosis or to patients not responding to, or to patients not responding to, right, MDR therapy. Okay, MDR TB therapy. MDR TB therapy की जो बात नहीं मानते हैं वो, और XDR TB, in both the condition, right, you can use the B-Pol regimen. I hope it is clear to all of you. B-Pol regimen was approved by which trial? NEET trial, right? It is given for what duration? 6 to 9 months. What does B-Pol stand for? Bedaquiline. ATP synthesis inhibitor है. Pretomanid, manid, mycolic acid synthesis inhibitor. Linezolid, one of the protein synthesis inhibitor. Cidal in nature. Okay, cidal in nature. Okay. So I hope it is clear to all of you, right? We can go to the next question. A 10-year-old boy with cholera right, presented with the cholera, physician has started ORS and azithromycin. The mechanism of antibacterial action of the drug involves, right? So they have started ORS and azithromycin. So they are asking the mechanism of action of the azithromycin actually, because ORS to actually your fluid replacement, and fluid replacement is the overall preferred in all the age group and all the population. It is the right most preferred therapy in the treatment of the treatment of the cholera. Okay. Alright, most preferred therapy. Please go ahead and provide your answer, guys. Most preferred overall will be same, that is your fluid replacement, right? Like ORS will be overall most preferred, but the examiner is asking for this drug chemotherapeutic agent, right? Antibacterial. So antibacterial to a key, that is azithromycin. What will be the answer here? Okay. Okay. Other student, please. Everyone should try. Azithromycin. Okay, good. So all of you are in favor of, that is B, right? All of you are in favor of B, right? Binding to a component of the 50S ribosomal unit. Now, first of all, let me tell you that azithromycin, guys, it's one of the macrolides, right? Macrolide, and macrolide that we are having, right? They are the bacterial translocase, right? They are acting by inhibiting your bacterial translocase inhibitor, right? Bacterial translocase inhibitor. So in the translocase, try to understand, right, the translocation from, just wait, let me just write it once again, bacterial translocase, protein synthesis translocase inhibitor. And the translocase inhibitor drugs that we are having, right, are the drugs like your macrolides, right? Then you are also having the clindamycin, right, quinpristine, and dalfopristine. Then you are having the ketolides. These are all the drugs under the bacterial translocase inhibitor. But you should also remember one very important thing, right? This is one question where antagonism of the bacterial translocase activity, that is one thing that I have justified. But read option B, binding to a component of the 50S ribosomal unit. Remember, here it should be in the option, it should be 30S, but since it is given 50S, right, the A and B both are correct statement here. A and B both are correct statement, because macrolide, they are also one of the 50S inhibitor, right? The only drug that are under 30S inhibitor are, right, aminoglycoside and tetracycline. Only drug that we are having under 30S inhibitor are aminoglycoside and tetracycline, right? So what we have here is A and B both are true statement here, right? Some of you are in favor of A, that is also correct. Some of you are in favor of B, that is also correct. Remember what I said, that only drug and under 30S inhibitor will be aminoglycoside and tetracycline. Aminoglycoside being a bactericidal agent and tetracycline being a bacteriostatic agent. Okay, another very important thing. DNA dependent RNA polymerase inhibitor will be your rifampicin, right? Rifampicin. Interference in the binding amino acid tRNA2, this is none other than your tetracycline. Right? So pardon me for this. A and B both are correct here, but since the information is important here, just go ahead with the information that bacterial translocase, these are the bacterial translocase. MCQ karo, that I have told you already. If you want to translocate from this phase to the post exam phase, then MCQ karo, right? Aminoglycoside, tetracycline are the 30S inhibitor. Rest all other drugs that we are having are the 50S inhibitor, including the macrolides, right? We can go to the next question. All right. In a penicillin allergic patient, you need to start macrolide group of antibiotic. Good. So that is the preferred agent. This is the drug of choice, right? Drug of choice in the penicillin allergic patient, right? Penicillin allergy, which antibiotic is preferred? That is your macrolide. Clarithromycin and erythromycin have similar spectra of antimicrobial activity among macrolide. The major advantage of clarithromycin is that, what does clarithromycin do? That means, what is the advantage of clarithromycin? Please start your answers, guys. Please start your answers. What is the major advantage that you see with the clarithromycin? Okay. Although definitely they both are enzyme inhibitor. Remember, they are enzyme inhibitor. That was the question that was asked in the June 2020 AIMS examination. They are the enzyme inhibitor. Therefore, drug to drug interaction will be very high, and therefore they should also be contraindicated with the drug that was theophylline, right? Zero order. In fact, not theophylline. Theophylline wala question to aaya tha. This question was asked in the examination, that is I am writing deliberately. But any drug that is following zero order kinetics, it should be contraindicated because they are the enzyme inhibitors. Okay. All of you are in favor of C. Some of you are in favor of A and B as well. A and B as well. Does not inhibit hepatic drug metabolizing enzyme. Guys, it is an inhibitor. It does inhibit. It does inhibit. Erythro, clarithrol, both of the inhibitor, right? Remember, it does inhibit. Okay. Eradicate mycoplasma infection in a single dose. It does. It is not effective against the mycoplasma group of infection. Greater activity against H. pylori, that is a true statement. It is because of this reason only, right? In the triple therapy, we use this. In the triple therapy that is used for the, right, H. pylori, we are actually using your clarithromycin only, right? We are using PPI, and along with the PPI, what we are using, right? Two antibiotics, right? Two antibiotics that we are having out of the CAM, right? Two antibiotics out of the CAM. What are the CAM antibiotics that we are having, guys? Two antibiotics out of the CAM, that is your clarithromycin, right? Amoxicillin, right? And metronidazole, right? Metronidazole. So these are the, out of these three CAM, only two will be used, right? Two will be used. So clarithromycin is the one that is preferred because it is having better activity against the H. pylori. So C is the correct answer here. Okay, I hope it is clear to all of you. And we are going a little yes. Okay, CAP you can remember like this: clarithromycin, amoxicillin, and also PPI. But here what we have, I have told you CAM. ऐसा इसका मतलब ये नहीं कि metronidazole you cannot use. You can use. Okay, you can use metronidazole as well. 55-year-old patient with the prosthetic heart valve is to undergo periodontal procedure involving scaling and routing. Several years ago, the patient has a severe allergic reaction to procaine penicillin G. So patient is allergic to penicillin already, right? Regarding the prophylaxis against the bacterial endocarditis, which of the following drug taken orally is most appropriate? Please go ahead. Please go ahead for this question. For the prophylaxis in the patient, this condition, which of the following will you prefer? Okay. Alright, very good. So this is one question that I have asked in the previous session as well. So I hope that all of you guys can get this easily, and you can, this is also one way of revising, right? That you are revising that in the patient with the, right, dental procedure as a prophylaxis we are using. Very good, guys. It is B and not A. Remember, it is clindamycin that is given. Clindamycin is the one that also happens to be one of the translocase inhibitor. It is also one of the translocase inhibitor. That is a drug of choice in a patient with the, right, prophylaxis against the endocarditis against the dental procedure. Usme it is considered as a drug of choice. Remember, right? It can also be used along with the penicillin G for the toxic shock syndrome, right? For the toxic shock syndrome. But in a patient with the valvular heart disease, if you want to give as a prophylaxis for the endocarditis, it is considered as a drug of choice. Remember, okay? It is having maximum risk of pseudomembranous colitis and also causing a neutropenia. So few important information I have highlighted. Please do remember that. Translocase inhibitor, very important. Only drug under the lincomycin. Remember that. Penicillin G ke saath you can use it in toxic shock syndrome, right? Then drug of choice in the endocarditis in the dental procedure in a patient with a valvular heart disease. Okay. Next question. 23-year-old female is pregnant and has gonorrhea. The medical history includes anaphylaxis following amoxicillin. So if a patient is allergic to amoxicillin, right, I told you what is the preferred, right? If there is a allergic to penicillin, then preferred will be your macrolides. Please provide your answer, guys. Which one of the following is a macrolides? I have already given you a very big hint here. I have already given you a hint here. Which of the following is a macrolide here? If there is any allergy to penicillin, then the preferred agent will be macrolide. Always remember this, right? And this patient is having gonorrhea, then definitely, guys, it will never be D, right? It will never be D. And also remember that if a patient is allergic to one beta-lactam, he is likely to be allergic to others as well. Therefore, cefixime, ceftriaxone, and, right, cefixime, ceftriaxone, they also will be, right, allergic, right? And the preferred agent is macrolide. So the only agent in the group which is macrolide is azithromycin. I just told you, right? If there is any allergy to penicillin, macrolide will be preferred, right? And remember the definition of the cross allergy, right? That if a patient is allergic to one penicillin, if there is an allergy with one penicillin, okay, allergy with one penicillin, the patient is likely to be allergic with others, right, others in from the same family, right. So all the beta lactams से allergic होगा except the monobactams, right, others except the monobactams, right. Monobactam के साथ cross allergy नहीं होता है because they are having the single ring. The drug under monobactam that we have here, Astronam. Okay, Astronam is the name of the drug. Okay. So A is the correct answer. I hope you guys have got this answer correctly. Okay, a patient upon release, right, she was advised not to rely solely on the oral contraceptive, right, to prevent pregnancy because they may be less effective while she is being maintained on the antimicrobacterial drug, right. Antimicrobacterial drug के साथ contraceptive failure are very common. The agent most likely to interfere with the action of the oral contraceptive is, okay. Please go ahead. The most likely agent that is going to cause, right? Yes, enzyme inducer, and one of the very potent enzyme inducer that we are having is the rifampicin. That happens to be a very potent enzyme inducer. It's a very potent enzyme inducer. Therefore, right, because they are very potent enzyme inducer, remember, right, the risk of contraceptive failure is very high. Okay, risk of contraceptive failure is very, very high. Remember, with the rifampicin. Okay. All right. So enzyme inducer rifampicin. Yes, guys. Okay. All right. So remember about this particular rifampicin that I have told you. It's what is the mechanism of action of rifampicin? That is another question that I have already informed it to you. Right. That is your DNA dependent RNA polymerase inhibitor. DNA dependent RNA polymerase inhibitor. Okay. That is very important. Right. About rifampicin. Right. The mutation that the resistance that we are having, resistance, this question has also been asked in the NEET PG. Resistance is mainly seen because of the which gene mutation? RPO-B gene mutation, right. RPO-B gene mutation की वजह से there will be resistance. That is also a very important question, right, very important about rifampicin. Okay. Apart from this, rifampicin can also be used, right, in several other conditions. There are other uses of the rifampicin that we are having. It can be used in the brucellosis along with tetracycline. It's a preferred drug in the brucellosis. It's a very preferred drug in the brucellosis along with tetracycline, right, used for the, right, treatment of the brucellosis. Okay. It can also be used in the leprosy, highly effective drug in the leprosy, right. In the leprosy it is also given, remember, once a month 600 milligram, highly effective drug in the leprosy, right, as a ATT drug. Right, it is used definitely, right. Where else can you use it, guys? Where else can you use? Where else can you use apart from this? ATT के सिवा और कहाँ यूज करेंगे? As a prophylaxis against meningitis, right? Meningitis, meningococcal meningitis prophylaxis, right? Prosthetic valve endocarditis, right? Prosthetic valve endocarditis. In that condition also it can be used. Okay, prosthetic valve endocarditis also it can be used. Rifampicin, you can very simply remember that mnemonic, burn lamp. Okay, burn lamp. Okay. So brucellosis, leprosy, ATT, meningitis, meningococcal meningitis, prophylaxis of the meningococcal meningitis, and P stand for your prosthetic valve endocarditis. All right. So that will be everything in this short series that I wanted to discuss, and we have discussed very important points in this. And tomorrow again I'll be coming live on 7 p.m. and also in the morning 10 a.m. So if you guys are free, please feel free to join the 10 a.m. session. That is also going to be very informative. All new question directly and different pattern of questions are all discussed, right? So 7 p.m. in the evening and in the morning 10 a.m. I will be live, right? Apart from this NEET PG 2020 series that is started, remember guys, free live test on Unacademy NEET PG app. It is there every day at 9 p.m. right? You should also know, right? Link of this has been given in the description only. Description of this class link has been given, and then for this student for the NEET PG 2021, it is every day at 8 p.m. right? 8 p.m. The link has also been given in the description. So if you guys are one of the students, those who are preparing for either 2021 or 2022, it's a very good, and it's all free. It's all free, right? You can also download the app. If you do not have the app yet, it's very easy, right? Simply go to your Play Store, right, and just type Unacademy, and you'll have to download this one, learning app. You will find educator app as well. Do not download the educator one. You will be downloading the learning app, and you simply select the right NEET PG and you go to the plus courses. If you want to subscribe, definitely you can get subscription. If you are not subscribing immediately, you can enjoy the free lectures. There are a lot of lecture and very important topics are being discussed by all the top faculties of this country. Okay, so that will be all from my side. You can use the code that I have given you already, right? The code that we are having is the Siraj Ahmad 9, right? Siraj AHMAD. If ever you are joining, to avail a 10% off. Apart from this, you can also use this one, right? Dr. Siraj -YT is the another code that you can also use. Both the codes are active. Either of them you can use. Okay. Siraj Ahmad 9 is very easy to remember. That is your subscription code. Okay. Apart from this, remember ACE FMGE, right, is the high yield December batch that has already started. This is for the plus subscriber. From the 12th October to 12th November, that has already started, I guess, and the students are already enjoying. If you are one of the students, those who are going to appear for this upcoming examination, definitely this is a very good platform for you. You should try it out. Okay. So that will be all from my side. Remember, my days on the special class is every Tuesday, Saturday, and Sunday. Right? That is special class. That is I'll be coming at 10 a.m. Right? And the YouTube session that we are having, YouTube, especially the Saturday, Sunday, 7 p.m. Okay, that is my days. Remember, weekend पे 7 p.m. पे मिलते हैं, right? So tomorrow 7 p.m. also and 10 a.m. also I'll be seeing. Thank you very much for your presence and attendance, and take a very good care of yourself. I'll be seeing you guys, right, in all these batches and all these classes that we are running live at the Unacademy. Thank you very much. Right?